Hello, my name is Nadine Voelkner, and I'm an assistant professor of international relations here at the University of Groningen. So my research revolves around the global politics of disease, and I'm grateful to the organizers for inviting me to talk about the current politics of COVID-19. So in this lecture, I want to problematize the war language. Just put on the next slide. I want to problematize the war metaphor used when talking about COVID-19 and trace this back to the security logic driving the global politics of infectious disease governance of the past 40-50 years. This will lead me to discuss the need to refocus away from the war rhetoric to the underlying social politics of the current pandemic. So let me move on to the next slide. Now we will all be able to say something about this, since the language of war has really become very evident in the way in which we approach COVID-19, governmentally and also socially. So we see a normalization of the language of war in this current situation of COVID-19. So what does it do? States are at war with a disease, COVID-19. You hear heads of states like Macron and Trump talk in terms of war as well. So Macron, in his speech to the nation, spoke about "we are at war." Trump himself talked about how he is a wartime president, invoking memories of courage and overcoming, etc., of the past. Hospitals are presented as battlefields. If you recall the images of North Italy during the peak of the epidemic there. Or look at the images we are receiving now from New York and elsewhere in the US also. Hospitals have become battlefields in which the healthcare workers, the nurses and the doctors, are the frontline soldiers who are sacrificing themselves for us. Economies are also talked about in terms of war. So what are the demands of the current situation that require certain realignments within the economy? And finally, the everyday language of you and I is also underpinned by war metaphors and war-like thinking. You recall the panic buying that went on a few weeks ago, or the invocation of a lockdown. All of these are terminologies that are used to refer to war tactics and strategies and politics. But what does it do to invoke war? The war rhetoric influences the way government and society respond to this pandemic. So the war rhetoric, or the language of war, or the invocation of war, simplifies very complex threats in terms of the friend-enemy binary. That is, us against the enemy. Specifically in this context, us against SARS-CoV-2 or COVID-19. It creates a sense of urgency and concentrates power to allow for the deployment of security forces such as police and even the army, and it facilitates extraordinary measures. The sidelining of perhaps normal legal frameworks. It creates a state of exception, to summarize. This can be a good thing, as we can see at this moment. It helps to raise awareness and it prepares for this war-like situation. So, for example, how do we meet the current needs and challenges of the health system? In turn, it helps to compel people to comply with state policies such as stay at home. It enables economic changes needed to face the challenge. For example, supporting the production and distribution of medical materials such as ventilators and face masks. Historically, modern war is an instrument of policy to protect the political community, so the state and its population, against a threatening foreign enemy. This is the job of national security, or this is the subject of national security. So let me go to the next slide. The relationship between health and security, actually, as it is presented today, is not at all new, because since the 1990s, mid-1990s, we have seen the increasing securitization of health in global politics. AIDS was the first disease that was securitized in 2000 by US aid. In 2001, with 9/11 and the beginning of the war on terror, we see that the threat of bioterrorism, more specifically, takes hold of this whole debate about securitizing health and national security. So the focus in global health security in the early days has, at least in terms of governments, has largely been around bioterrorism. Now in 2003, you see the emergence of SARS, in this case SARS-1, which was not a pandemic, but it had pandemic potential. And the experience of SARS-1, or SARS, at the time, really showed how interconnected the world was because of the jump of the disease between one global city to the next, and how it affected people as far apart as China and Canada, for example. So in response to the exponential increase in international travel and trade, and emergence and re-emergence of international disease threats and other health risks, the international health regulations, the international health regulations were revised in 2005 in order to meet these challenges. 196 countries agreed to implement the international health regulations. These regulations became binding. They're enforced then in 2007. What this tried to achieve was to set up a surveillance infrastructure, global surveillance infrastructure, in which the dynamics of disease and the emergence of particular infectious diseases could be traced and also then acted upon early on. So states agreed to strengthen national capacity for disease surveillance and control through national international health regulation focal points. And these the information that was collected through these was then transferred back to the WHO, and its global outbreak alert and response network then was able to oversee what were the dynamics happening in the world. And there was discussion that followed up from whether there was a need, when an event occurred, to call out a public health emergency of international concern. Now for Weir and Michalowski, this meant creating a world on alert, in which the world stood constantly under threat of lethal pathogenic microbes of epidemic and pandemic potential. But there was another discussion that was also raised in relation to the problem of balancing public health and individual freedom. So the war rhetoric during COVID-19, if we look back at some of the literature from that earlier debate, is legitimizing authoritarian-like measures and rule. So fear becomes an important tool of control that increases acceptance to exceptional measures and limitations to individual freedom. You might have also noticed there's an increasing level of policing in cities and states. And there's also discussion of more surveillance. New surveillance technologies are being introduced, such as apps using geolocation for contact tracing, such as have already been implemented in Singapore and Taiwan after the first SARS event. And now it's being discussed also in Germany and the UK. Now, sociopolitically, the war language justifies fight and flight behaviors, such as selfish actions, like the hoarding of face masks, toilet paper, and hand sanitizer, and also guns in the United States, for example. It incorporates dehumanizing language, racist language, such as is the problem when you denote a particular disease in terms of a country. And finally, it also creates the danger that another endless war after the war on terror might be put in place. An endless war against an ambiguous enemy that also raises the concern that all these exceptional measures that are being put into place now will remain into an undefined future. In fact, the language of war and security detracts from socio-political problems and inequalities enabled by previous political decisions, such as that our health systems are ill-equipped, more generally, and especially during pandemic times, that there's insufficient access to healthcare for people, that there's in fact even lack of communal solidarity in times of fear and anxiety, that perhaps there's been too much of a trust in neoliberal economic logic rather than other forms of organizing economies and political economies. And finally, that there is perhaps an overly trustful understanding of technological progress. What the war language does not consider is that we are not, in fact, at war. Viruses belong to the microbial species that have resided in and on the human species for a very long time. And I would argue that the virulence, i.e. its harmfulness that they have, depends on the ecosystems its hosts inhabit. For example, the human body, the environment within which the human body is placed, whether it's a rural or urban space, a slum or a palace. And it's these sociopolitics of the environments that we must understand and change in order to prevent the emergence of another COVID-19 disease outbreak. So there I'm going to end my lecture, and thank you for your attention.